everybody to our IGHD Brown Bag sessions. It's so lovely to see colleagues and PhD researchers and also some of our MSc students join us as well. As you know, we try to do a Brown Bag session one per month, and we invite colleagues from all over the UK and the world to share with us some of their research and their ideas and see how we can create connections as well with the work that we are doing. And today I'm extremely, pleased to be able to welcome my colleague, Dr. Nabeela Ahmed. Nabeela is a lecturer in human geography at the University of Sheffield and the School of Geography and Planning. Nabeela is a feminist critical geographer focused on post-colonial context, and her research interests and experience intersect three main domains: urban migration and labor precarity, social and spatial inequalities, and digitalization and governance. Before doing her PhD, Nabeela worked as a practitioner for NGO, including Black in Bangladesh, and I partner in India. And I have the pleasure to meet Nabeela for many years now, so I'm very happy that she was able to join us for this Brown Bag session. So as I said before, in a Brown Bag, we have up to 40 minutes that we invite the speaker to talk about the topic. It could be less, and then hopefully we will have 15-20 minutes for Q&A at the end. So thanks, Nabeela, so much for your time and for joining us today. And I'm sharing your slides now. The floor is yours.
Thank you so much. Can everyone hear me? Yes, great. And Marcia, thank you so much for the invite. It's just a wonderful privilege to know you, but also to be invited to speak here at the IGHD. And thank you also for helping me with the slides. So when I need, I'm sorry about that as well. When I needed to change the slide, I'll just say next slide. Thank you. Today I'm going to try and at least get into an outline of infrastructural stigma, which I've written about before. It's a kind of conceptual approach I'm taking to my work with labour migrants over the last almost 20 years now in Indian cities. And I want to discuss how that can help us understand embodied migrant labour and barriers to health and well-being. So before we even get into the slides, I want to share a quick story from my fieldwork. So I've changed names to protect anonymity, but let's talk about Adir. Adir is in his mid-30s. He's originally from rural Bihar, which is in the north of India, one of India's poorest states. He's a Muslim smallholder, which means he owns a small plot of land, but his land cannot produce food for either subsistence nor for sale. So he's forced to migrate to find labour in cities to sustain his livelihood of himself and his family. He has a wife, 3 kids, and an elderly mother who lives with them. He spends up to 8 to 12 months at a time away from his home village in cities, mainly in Maharashtra, which is in the west of India and one of India's wealthier states. And he is hired on contract labour to work in construction. He works in what's called so-called low-skilled labour, low-paid labour, and as I said, as a builder on a luxury housing development right now when I meet him. And with no access to safe or concrete housing, he's forced to live on the land that's in a labour camp that's provided by the employer for free. However, this labour camp lacks basic resources and infrastructure such as clean toilets, water, cooking fuel, electricity, and so on and so forth. And it's also adjacent to the construction site on which he works. So the site itself is remote from a lot of resources and accesses in the city within Maharashtra. He currently works at the time of meeting him, long full-day shifts, as I said already, for low wages, without a hard hat or visibility gear or safety protection that you would expect on a construction site, often working high up on precarious scaffolding. He is currently, at the time of meeting, paying off debts to his previous employer on a construction site in a different city because that employer covered his hospital costs due to a work site injury. So he's still paying off those debts, and what little left is he remits back home to Bihar. And though he's an Indian citizen, born and bred in Bihar, he is structurally and socially discriminated against because of his status as a Muslim. My research was was at the start of the current Prime Minister's tenure, Prime Minister Modi, that is, but who has kind of, to summarize, enacted a series of laws and constitutional amendments that make life harder for Muslims, to summarize it. So Adir is one of those precarious people, and he's denied rights to social protections as well as free health, such as free healthcare and food subsidies. So that's the story about Adir. And if we move on to the next slide, thank you so much. Adir helps us understand, hopefully, what the role of infrastructure is in furthering, exacerbating, and reinforcing a wide range of precarities, violence, and objections, and also a denial of rights to health and well-being. So I want to start with this concept of everyday infrastructures and why it's worth studying. We may think of infrastructure as the domain of urban planners, architects, engineers, but the work of Suzanne Lee Starr, who I cite here, calls for a recognition of the ways in which infrastructure shapes our everyday lives and outcomes, both geographically and demographically, due to complex, widespread processes of power and inequality. So these are the concerns of any social scientist, particularly for a social scientist such as myself, an urban geographer who's preoccupied with inequality and its drivers. So everyday infrastructures, I draw on Starr's definition from 1999, but still very relevant today. Her contention is that infrastructures are relational, they're material, and they affect our everyday lives. And she talks about how infrastructures can be seen as a system of different layers that tend to be invisible and part of the background, depending on where you live and who you are. So if you live in a privileged area, if you live in a typical global north, privileged part of a city, you probably don't even pay attention to infrastructure because it's running in the background. You turn on your tap, the water comes out, you turn on your switch, the electricity comes on. But obviously one person's infrastructure is another person's topic or difficulty. When you are living in a deprived area of any part of the world, but particularly in global south post-colonial cities, the lack of infrastructure governs and defines your everyday life, whether it's access to toilets and sanitation, water, fuel, electricity, transport, public space, and so on. So as I said, it's the kind of junction of material structures around us that some take for granted and some don't. It's relational, humans impact infrastructure and vice versa, and it governs our everyday life, obviously to different extents. Yeah, next slide, please, thanks. And why study everyday infrastructures, even if you're coming at it from a public health perspective, for example, or if you're looking at migration or anything that is to do with social inequalities? Well, like I've already alluded to, it's shaped by power, politics and economics, who invests in infrastructure, who funds it, who plans the city, who gets to do these things, who is the so-called beneficiary of such processes. Infrastructure can also be violent. This is also very influential in my work. Rogers and O'Neill coined the term infrastructural violence. Apologies for not including the citation for Gregory, but these authors talk about how infrastructure can enable, channel, and enact ways of making material structural violence, whether that's racialization or sexism or class-based discriminations. Infrastructure enables these ways, often in very direct as well as indirect ways. As building on from Starr, the presence of infrastructure, as we're going to look at with the construction workers in India that I'll talk about in a moment, the presence of precarious or dangerous infrastructures can affect people in harmful ways, but also, like in the same way, absence of infrastructures can affect people in different and unequal ways. I've already mentioned lack of access to water, electricity, and so on and so forth. And overall, it affects the mobility, access, health and well-being, safety, and even zooming out, freedom through the inequality of regenerative and reproductive services and systems. And the approach that I'm taking to infrastructure, specifically this idea of infrastructures of stigma, I'm moving away from classical urban theories, maybe not classical is not the word, but established urban theories. For example, Graham and Marvin are urban theorists who talked about splintering urbanism, where the development of cities or the urbanization of cities has actually led to further fragment urban populations through, for example, differential access to transport or public space. And I'm adopting a specifically post-colonial approach to see that rationalizes this fragmenting of cities through infrastructure as an intentional and historical process that actually stemmed from colonial rule, particularly in the case of Indian cities, where under British rule, cities were designed or planned in ways that were segregated and according to a racialized logic that would privilege those who were in power at the time and obviously more elite groups of Indian populations, and serve to exclude key resources, whether it's a water supply or public space, that would be denied to those who were most marginalized in cities. So this is a historical process that's still unfolding in terms of its legacies today. I also draw from the likes of Abdulmalik Simone, who observed post-colonial cities in South Africa and looked at how people work with each other and use their resilience and strategic agency to create infrastructures in place of formal, in the absence of formal infrastructure. So that could be waste picking and disposal in the absence of formal waste infrastructures, market exchanges, transporting water physically, social support and community in ways that will, in improvisational ways that make up for the lack of state or commercial infrastructures. Thanks. And then zooming in a little bit closely on this idea of infrastructure stigmas I've written about. So if we think of infrastructure as a representative of the state or of capital, it plays a key role in configuring stigma, violence and abjection, and foreclosing access to health and well-being. So we might think of the stigma as it was coined by Goffman in 1963, actually, as a form of social control. But if we look at infrastructures of stigma, we understand how these forms of control and inequality are constructed through material structures, through material, embodied, and spatial modalities, as I've said here. So, for example, infrastructural deficits such as inadequate water supply or sewage systems, vulnerable housing, as you can see in this picture here, of a typical informal settlement in Maharashtra, hostile public spaces without accessibility or lighting, they can all further impact the mobility of already marginalized groups. And I've written about this, for example, in respect to gendered access to the city in the past. Yeah, next slide, please, thanks. So here's the context. So I've given, hopefully, an overview of what I mean by everyday infrastructures, drawing from the literature and my own conception of infrastructures of stigma. A lot of this is based on my empirical fieldwork done in urban India. So the problem with giving you a context on urban labour migrants within India is there is no, the latest census data that's available was in 2011. That's still the case for a variety of reasons I can't get into here. But within that census data, I'm sure this is common amongst other countries as well, with high internal migration, the number of internal migrants is not correctly, accurately captured. And what that leads to is an invisibilization of a very widespread historical and precarious historical process of creating precarity. So these are just indications based on a number of respected scholars who've been working on this field for a long time. So I draw from Rajan and scholars at the India Forum to estimate that currently there are around 200 million internal migrants working in labor, working in informal low-income labor. The total number is projected to be 600 million, but within that, those who are working in precarious, informal, low-paid labor are 200 million. And this has been attributed to a post-pandemic agrarian crisis, land issues such as those experienced by Adir, growing urbanization. So these are the folks who are the backbone of India's economy, if you like, and the backbone of India's urbanization. The map that is here on the left of the slide, like I said, is from the 2011 census, but it just to give you a sense for those who may not be familiar with the context of India, it's a very large country, but it's also a federalized country. So while it has a national government in place, each state is responsible to some extent for its own economy and political governance. And what it results in is huge spatial, geographical, and regional disparities. So you'll have, as I've mentioned, Bihar, which is where Adir is from, is in the north of India. If you can see, I don't know, yeah, basically, in the northern tip of India, it's one of the poorer states, Uttar Pradesh, West Bengal, and then the wealthier states are in the west, so Maharashtra, obviously Delhi in the capital, which is in the north, and Gujarat. Obviously, this is changing somewhat in the last 20 years, sorry, but this is just to give you an idea of why internal migration is significant in the case of India. The patterns are varied. Just to give you a quick summary, labor migration can take place on a seasonal basis, depending if it's agricultural or brick kiln work or circular or long term. It can be interstate, so long distances from north to west or south India and vice versa, or intrastate, so within a particular state. Migration can be undertaken as a household or as individuals, depending on the sector, depending on the region. And it's typically driven by a lack of employment, as we heard in the story of Adir, or subsistence. And laborers are compelled to join low-skilled, risky, and low-paid labor. For example, a lot of it is involved in the building of infrastructure through construction or brick kilns. The next slide will show us, thank you, again, an overview of the typical nature in which labour migrants, particularly from rural areas, are recruited. So they're recruited via complex translocals, so across different spaces, chains of intermediaries or brokers, who are often typically belong to the same region as the labour migrants. And labour migrants are often recruited according to caste or religion or region. Thus, the stigmas that they may have faced in their place of origin, whether it's Adir in his village in Bihar, are carried on over to the cities that they move to. So we might have a notion of migration being a way of escaping particular home-based stigmas or discriminations, but that's actually carried over in this case. Debt is often accrued through an initial advance system. Again, this isn't unique to India, of course, but it gives you an understanding of the kind of precarity these laborers face. So they're already in debt, and then they pay it in advance to a broker, and then once they start to earn wages through, for example, construction labor, a large part of the wages are paid back through this accumulated debt. And as I said, they're predominantly from India's poorest states, disproportionately from marginalized or so-called low caste groups or religious groups, Dalits and Muslims, and they're employed in labor that's historically and socially stigmatized. So waste management, dirty, dangerous, and I forgot the third D, but work that's considered not appealing to the rest of society, so to speak. And I focus mainly on interstate migrants, but it should be acknowledged that intrastate migrants, which can be conceptualized as a kind of more local kind of migrant, so moving from rural to urban areas within a particular state, are typically dominated by Adivasi or tribal groups, who are among the most precarious in Indian society, who face drought-stricken rural areas, and a large proportion of female or women migrant workers belong to these groups. So moving on to the next slide. I'm not going to spend too much time giving a background on where I did my research, but you can hopefully see in the west of India, Nasik, yes, thank you, Marcia, highlighted in yellow. It's a city that at the time was becoming what's called a tier 1 or a mega city in India. Now in 2026, it definitely is a tier 1 city in terms of size and population, but it's very close to the more obviously famous and industrialized cities of Mumbai, Pune, and had a lot of demand for migrants because it was fast developing at the time when I did my research there. If we move on to the next slide, I just want to give you a little bit of an overview of the very specific kinds of violence faced by labour migrants in India. So even though these are Indian citizens moving across state lines, they're treated as interlopers or outsiders, much in the way that we see, unfortunately, here in the UK or in other parts of the world. So it also unsettles this idea of migrants being international as well, I think. So these are some stories, both international and local press, covering the violence, targeted violence against specific migrants. There's even derogatory terms for migrants from the north of India or south of India in Maharashtra, which is politically quite particular within the state of India because lots of anti-migrant local political parties hold sway there. So we can see that already this is a marginalized group of people due to historical processes of caste, gender, class, religion, region, etc. Layered onto the fact that they're seeking precarious forms of labor, layered onto the fact that they are discriminated against. Once they move to a city such as Nashik and start working on a construction site, let's say, they then face, due to, in part to infrastructure, a series of what I call embodied and material risks to health and well-being or precarities. The labor itself is highly hazardous. So this is a kind of a press image that I've included from the Adani Group, which is one of the wealthiest companies in India, involved in construction as well and real estate. Highly hazardous labor, working in precarious structures with no or inadequate safety gear. So the picture that you see is a press image that is very different from the kind of reality that you see on the ground, even today. And workers are constantly in contact with dangerous materials, and they carrying things that would normally be mechanized, lacking protective gear when working on these precarious structures. So not only do they have direct risk of fatality or accidents, but also experience physical burden over a long period of time. It also comes from the residential situation. So like Adir, lots of construction sites will offer housing on the site itself or next to the site itself in a labor camp, which is essentially just the same as any informal, low resource informal settlement that you might see. In places such as India, lack of water and sanitation services, cooking fuel, electricity, etc. So you have the conflation of the labor precarity and also the everyday precarity at home, cut through by different absences and presences of infrastructure. There are gendered consequences. I've written about this before with Ahmed on in terms of safety and risk, but also in terms of stigmas of caste, religion, region, and class. So your access to certain infrastructures will be mediated by this as well. There's evidence of widespread malnutrition among children of labour migrants when they have to move as households. And this is compounded by a lack of implementation of legal protection. So there are laws in place, both at the state level and national level, and these continue to be drafted and amended. However, despite corporate kind of despite the scale of the corporates involved in these construction sites, these aren't implemented in reality. And I'm just offering here a conservative estimate of 11,614 fatalities in construction over a period of 4 years, according to a study by IIT in 2016. And it's considered the second most risky sector in India, the first being brick kiln work. So the next slide, thank you. I just want to list 3 examples from my empirical work and construction sites, such as the one I showed you. Kind of anonymity purposes, I'm calling this site Premier City, but that's not the actual name of the site in Nashik. 3 examples of how infrastructure can play a role in outcomes, in health and wellbeing outcomes. So at the time of my fieldwork in this Premier City in Nashik, I witnessed the aftermath of an outbreak of malaria. So at a labour camp of 500 residents, adjacent to a construction site, an outbreak of malaria took place, and I was able to visit an NGO intervention that was provided a checkup and treatment for people who are suffering malaria. However, the session itself was very small in a cramped space and definitely was disproportionate to the number of people in the camp. I'm sure that not everyone in the camp reached or could benefit from that session. And the malaria was exacerbated by obviously these poor water and sanitation infrastructures. Malaria already is common in urban spaces after monsoon, but in this particular cramped condition, standing water attracted obviously mosquitoes and triggered the spread of malaria in these crowded spaces. And the session was also an opportunity, whether it was intended or not, for the labourers to voice their concerns. So we have the kind of public health outcome here. And the next slide, thank you. You have what I've called safe access. So a lack of safe access as a result of many factors, but infrastructure included. So this is a picture I took of the site itself, of the housing. So this is a small snapshot, if you like, of one of the lanes of this labour camp, and you can see in the background the construction site. Women took the chance at this malaria outreach session to complain about the lack of accessible, clean, or proximate toilets. So the toilet facilities, depending on where you are in the camp, were on the other side. So if you were from a particular state or religion or caste, you'd be living in a more disadvantaged position within this camp. So it's a common challenge across informal settlements the world over, but also in this construction site. Lack of lighting, you can imagine trying to find a toilet in the dark is not great at the best of times, but not in a male-dominated labour camp. Maintaining a safe level of hygiene. Obviously, this is all before COVID, but you can imagine what kind of public health outcomes could emerge from that. And then this is also, like I'm always trying to emphasize, layering onto existing gender discrimination and intersectional stigmas based on religion, caste, and language. So there's a long history of infrastructure being divided or denied to those who are historically discriminated against. And that was even happening here in this labour camp. In the next slide, the third example is kind of more direct. If we think of the other two as more indirect or long-term or slow-moving, this here I'm trying to capture the risk of direct bodily harm outcomes. So I've shown you some pictures here. Notice the lack of safety gear and the precarity involved. So these construction sites, which are serving the urbanization of India and serving the elites of India, and creating new infrastructures, ironically, are immediate hazard-prone sites for those who work on them. There's as I've said before, lack of safety gear, precarious scaffolding, heavy labour in lieu of mechanization, so carrying heavy loads. This is typically done by those most marginalized already, so women and Adivasis, despite regulation in place. So you've got the direct risk of being hurt or even a fatality, as the case of Adia showed, but you also got to have the long-term health hazards of doing cumulative effects of hard labour, often into old age. There's also the conflation, right? The spatial or infrastructural conflation of work and labour. So there's no rest or respite from the continuous burden faced by labourers in these sites. So the next slide, I wanted to, like I said, this research was done in a long time ago, but in 2014, but the COVID outbreak that we all experienced, of course, or witnessed, in India was dealt with in a very particular way that was abrupt. So overnight in late March to April 2020, a national lockdown was declared in this, like I said, large and highly federalized country. When it meant tens of millions of urban migrants were forced to return home. And this was widely covered in the international media and often compared to the partition of India, which was another period of intense mobility and expulsion. So often on foot or in precarious infrastructures. So there were reports of train crashes or sleeping migrants being killed by moving trains on their journeys back home. People who were, upon which cities were reliant to run, were suddenly forced to go back home and often denied wages or not paid wages, denied access to existing food subsidy programs, no state protections. I remember a quote in a BBC news story where somebody interviewed said, we'll die of hunger before we die of COVID, which captures the kind of immediate precarity faced by labour migrants here. And often upon arriving home, they would be hosed down and subject to inhuman treatment, quarantine conditions. So what this did at the time was crystallize, and for those of us who've been working on internal migration for a long time, it's often, as I said, not recorded adequately, it's invisibilized, even though it's widespread and prevalent, and like I said, the backbone of India's economy. 2020 trained the spotlight on long-standing migrant precarities and violence for the world to see. So and the role of infrastructure was key in that, whether it's returning home and not being able to access safe infrastructures, whether it's not being able to access safe public health infrastructures. We've already talked about what happened with the malaria outbreak in the Premier City site. Imagine what happened at a nationwide scale. So the absence and presence of infrastructure exacerbated those impacts. Thank you. Here is a kind of a visual crystallization of what I've been trying to explain is these multi-layered stigmas. They're both spatial and they're temporal, so they work over time and space. You have, and it's very simplistic, of course, but it's just for us to understand the relationship between these different forms of sources of stigma and violence. Caste, religion, and gender, which are historical, exacerbated over time, exacerbated under colonial rule in India. Many of them are prevalent across marginalized people across the world. Caste obviously is specific to the case of South Asia. So you are almost born into these systems of precarity and violence, layered on by class and labor. Obviously, we understand being poor or working in a labor, particular kinds of labor, affords a particular class status, which is neglected in society. And then the stigma of place, so where you're from. So depending on if you're from one of India's poorest states, such as Bihar, or a predominantly Muslim state, or a state that, for example, West Bengal abuts Bangladesh, and there's a lot of porous migration between Bangladesh and India, which is still a huge phenomenon, you're often conflated as a Bangladeshi migrant if you're from West Bengal and if you're Muslim. So a number of complex stigmas related to citizenship rights and related to social structures are already in place. And if we move to the next slide, the role of infrastructure, urban everyday infrastructures, whether working in them or experiencing them or not experiencing them, configure how these work or reinforce them. So it's important to look at that in addition to everything else. If we move to the next slide, how am I doing for time? Okay, so I wanted to finish off by offering why it's important to look at urban everyday infrastructures if you're concerned, particularly, especially with health and well-being in cities. As a concept, it helps us to understand the very material realities of what we might call, some scholars call abjection, marginalization, exclusion, precarity, or on the flip side, a lack of access to health, well-being, life, reproduction, etc. So conceptualizing infrastructures helps us to understand this in a more material way. It's also useful as a political concept for understanding, for representing structural violence or social violence in an, for want of a better word, undeniable way. We can all observe infrastructure, we can all observe its absence, or whether it's a bridge breaking down, or a train stopping, or flooding caused by infrastructure or exacerbated by infrastructure. We can all see it, and therefore it can call into account lack of governance, essentially. It's observable, as I said already, an observable link between urbanization or urban development at the cost of the marginalized. So you can actually very clearly and visually and viscerally see that. And then as I try to offer as well, stigma, infrastructure helps to keep stigma in place, right? It helps to keep it spatial and territorial as well as obviously social. Infrastructures, if we move to the next slide, is also hopefully self-evidently important as an empirical approach, especially for geographers or those of us concerned with space or socio-spatial relations and realities, because focusing on the phenomena of infrastructure, whether it's in a city like you can see in the background here, or in an underserved settlement or building site, it can be a useful starting point or end point to observe and analyze through material structures. And it allows us to trace the complex relationships between governance, capital, space, labor, etc., to understand barriers to health and well-being outcomes, not only in a kind of conceptual level, but also in a bodily and material level, as I've hopefully shown. And then finally, infrastructure as method. I draw really heavily from the geographer Debbie Cohen here, who talks about following infrastructure as method, and how it allows us, particularly in post-colonial, or in the case of Cohen, settler colonial context in Canada. Following infrastructure allows us to understand the colonial intimacies of containment, premature death, and division. Yet it also makes visible the struggles over infrastructure, and in doing so, it can offer a glimpse at how infrastructure can be built otherwise, so that reproduction can be redirected to underpin alternative intimacies based on alliance, mutuality, and solidarity. So obviously, Cohen's drawing a lot of things I've left out of this presentation. That is the site infrastructure, the site of resistance and against denial of health and well-being opportunities. And following, whether it's following through archives or through maps, or through spatial representations or through observation, the development, the process, the spatiality, the actors involved, and the experience of infrastructures enables us to expose, map, and record how inequalities, for example, in this case, of health, well-being, and precarity are historically shaped over time and space. And I'll leave it there for now. Thank you. I've got some references.